Welcome to the Helen Bader Foundation CBRF Caregiver Training Program. This unit is on the management and administration of medications in the CBRF. It's divided into a number of sections because there's so much information. Each has a video and it has a workbook. We know how important it is for you to know and understand how the body works and how it changes with aging and how that affects your residents. Now, I imagine you're familiar with some of this information, so I don't want to insult you with that, but my experience has been every time I review the information, I'm able to learn new things and be able to apply those to my work setting. So hopefully that'll work for you too. I'm Maren Meyer, I'm a pharmacist, and I'm involved in public health education and in long-term care consulting. Now, each of our units starts with a pretest. The pretest and the post-test are the same, so don't be intimidated by this because there's no grading. The purpose of the test is simply to let you know what you already know and what kind of information we hope that you'll get out of the video. And now I won't cover all of the information, so you be sure to read the handbook. But before you do that, what I'd like for you to do is stop the video, take the pretest, and then come back. Hi, welcome back. We're going to talk about aging and body systems. Now, in this unit and in all the units that I present, I will be using the terms medicine, medication, and drug interchangeably, so don't be surprised by that. They basically all mean the same thing. As we age, we can pretty much expect that our organs are not going to function as efficiently as they did when we were younger. We'll be more prone to disease, and we have a tendency not to heal as easily or as rapidly as we did when we were young. That's just part of the normal processes of things. And as long as we take that into account, we can make adaptations for it, and it doesn't have to disable us. Let's start with the skin system. This is called the integumentary system. And if you were seeing a doctor for your skin system, you would see a dermatologist, unless, of course, you were able to have a family physician take care of it. But the specialist is called a dermatologist. The skin system includes your epidermis, which is actually the dead layer of cells on top of your skin. That comes from the dermis, which is beneath it. And beneath that is the subcutaneous layer. And that's the layer that has that nice little fat layer underneath that gives us this pretty plump look. The skin functions to protect us, our inner workings, from the environment. Okay? It's the largest body system that we have, and it's a very important one. Even though it's incredibly thin, it's very effective at protecting us from the environment. It protects us from being dried out. It protects us from light. It protects us from microorganisms. And it's really kind of amazing, I think. It also has in it the nerve endings so that we can sense our surroundings. And the other thing that it does is through the subcutaneous layer with the layer of fat in there, we find that the skin is involved in helping to regulate the body temperature. So as we age and that little layer of fat kind of thins out, we find that our body heat can be lost much more easily. Besides that, there are some familiar signs of aging with the skin. The skin is, boy, it's a dead ringer. It gets dry, it gets thin, it gets itchy, and that includes not just the skin that we think of as skin, but also our scalp. Our fine lines in our face, sad but true, they deepen into wrinkles. And parts of our skin that we've exposed to sun start getting little brown spots, which my grandmother always called liver spots. And she always used creams to hide those. But those are a normal function of aging. Like I said, we lose that cushion of fat, and so we start to look a little more gaunt, and our skin starts to sag a little more. Sounds really depressing, but it's not that big a deal. The important things that can be a problem is that with the skin thinning, the skin tends to tear more easily. So if an individual, say, bumps themselves on a table, or say they fall and they bump their skin, the skin can tear a lot more easily. The other thing is that skin can lose its ability to sweat or perspire as efficiently. So not only are you losing heat more easily, but just body heat regulation is more difficult. Some of the common skin disorders that we see in older people are listed here under section 4. So what do we do about these conditions? Well, we try not to use drug measures, but in the case of the skin, a lot of the things that we can do is we can rehydrate the skin, and then we can apply things like antipruritics to relieve the itching, and we've got some examples here, Benadryl. You can also use non-drug creams, for example, Eucerin cream, which just, when the skin is moist and you apply the barrier cream, it holds the moisture in. These days, skin preparations have become really quite a science, and some of the products that you see that are available without a prescription will have a notation on them that says that they have special lipids in the ingredients. Those lipids actually help renormalize the skin's ability to retain the moisture, so that you're not just trapping the moisture on the skin, you're actually drawing the moisture back into the skin and kind of rebuilding the skin's natural environment. Other drugs that are used for skin conditions, anti-inflammatories to reduce inflammation, you've probably seen hydrocortisone or triamcinolone, and we've listed some examples of many kinds of skin preparations here for you. Triple antibiotic ointment for minor cuts or minor infections. The musculoskeletal system. Now, the musculoskeletal system includes the bones, joints, and muscles. And its function is to provide us with structure, otherwise we'd be sort of like amoebas. It gives our body shape, it provides a framework for our organs, keeps them from falling in on each other, it maintains our posture, it allows us to be able to breathe, and it also produces heat, which is kind of interesting. You don't think about the bones so much producing heat, but your muscles, as you know, when you exercise, say you carry groceries in from the car, you know that you generate some heat doing that, or these days, shoveling snow. As the musculoskeletal system ages, there are a lot of changes, and these changes are the main cause of functional disability in people over 65. So this is a pretty serious issue. Some of the common musculoskeletal problems that we see in older people are osteoarthritis. Now this arthritis business is pretty confusing, I think. There are a lot of different arthritises, okay? There's gouty arthritis, which we call gout. There's rheumatoid arthritis, which is called RA, and rheumatoid arthritis is actually an inflammatory condition that starts in younger ages, and if a person lives into their older years, it just continues to progress. The arthritis most of us see is called degenerative joint disease, or DJD. That's the osteoarthritis. So what kind of medications do we use for musculoskeletal disorders in the elderly? Well, hopefully we're using some calcium. And we've given you some examples under 5 here. Calcium is recommended for men, 1,000 milligrams a day right now is the recommendation. For women, it's 1,500 milligrams, and most of us really don't get that in our diets. In the northern climate, which is where Wisconsin is, a lot of times people are not exposed to enough sunlight to be generating enough vitamin D to really utilize the calcium in their diet well. So a lot of times we see people taking a calcium supplement with a vitamin D supplement too. You never want to exceed the recommended daily allowance of the vitamin D especially. Most people, if they have fairly healthy kidneys, could get rid of extra calcium if they accidentally took that. We also see the use of a lot of non-steroid anti-inflammatory drugs. Now, the examples we've given you here are Relafin and Tylenol. Tylenol is not really an anti-inflammatory drug. It's for pain. And it's listed there to kind of remind us that if an individual has a condition like osteoarthritis, which is not an inflammatory condition, the best thing to try first is scheduled Tylenol. And the reason for that is it's fairly effective, and it has a tendency to cause fewer side effects than any of the other drugs that we could try. After that, physicians generally try things like Relafin or ibuprofen or Motrin. But those do affect the kidney, so we want to remember there's no free lunch when it comes to drugs. There are gout medications, anti-rheumatoid medications, and something you see used sometimes when an individual has a lot of pain in a joint is a steroid injection into the joint, and sometimes a burst of medication on a steroid. For example, where they take 5 pills on the first day, 4 pills on the second day, 3 pills on the third day, and so on, to give them some inflammatory relief. There are also muscle relaxants. I really worry about elderly people receiving muscle relaxants, not because it is an appropriate therapy, but because it requires special monitoring. Muscle relaxants, because they relax the muscles, in a person who's already weakened, may really increase the risk of falls. And a fall is such a dangerous issue in an older person. So because of the sedation and the relaxation, we really want to monitor muscle relaxants carefully. The other thing that we have listed is antibiotics, because like I said, sometimes bursitis will be due to, or a bone infection will be due to an infection caused by bacteria, and we can treat that. The cardiovascular system. The cardiovascular system includes the heart, the blood, and the blood vessels. And it functions primarily as a transport system, okay? It gets things from here to there. It gets oxygen from the lungs to the cells. It gets carbon dioxide, which is a waste product, essentially, of the cell metabolism. It gets it back to the lungs and gets that out. It takes other cell wastes and gets rid of them, takes them to the kidneys or to the intestines. It helps to regulate body temperature because it is a fluid. And it produces and carries the cells that both carry the oxygen and that protect us from infection. So this is another very important system. Now, like I said, all of these systems are interrelated. All right, let's talk about some of the changes that occur in aging of the cardiovascular system. And then I'll give you an example of some of the issues that you need to keep in mind. As you age, the heart muscle is less effective. Each time it pumps less blood, so it delivers less oxygen to the tissues. Now, we're talking about tissues like the brain, the liver, the kidneys, and all of those are obviously important just for your general well-being, and they're also very important when it comes to drugs. Some of the most common cardiac diseases include congestive heart failure. What that means is that the heart is not able to supply enough blood to supply oxygen to meet the needs of the tissues. So it can be related to a number of reasons, but primarily in older people we see that simply the heart is just not able to pump strongly enough. And normally you've seen digoxin used for that because it strengthens the beat of each heartbeat. We also see irregular rhythms developing in the heart muscle. Normally we have 2 spots where the heart rhythm is established. And as we age, we find more and more renegade spots in the heart that are trying to take over the rhythm of the heart. And that can cause a lot of troubles because then the heart becomes even less efficient. Coronary artery disease is probably one of the most well-known conditions in America right now. And that's either the buildup of, for example, of a kind of plaque or cell deposits inside the blood vessels, or it can be due to a constriction of those blood vessels. Coronary arteries are the arteries that feed the heart muscle itself. And if you don't keep that heart muscle healthy, then it can't supply the rest of the body. We also have blood vessel diseases, and an example of that are thrombi, which that just is a fancy word for clots, okay? A clot can block off an artery in the leg, it can block off an area in the lung, and it can also block blood supply to an area in the brain, so that can be quite a problem. A lot of individuals now are taking a low dose of aspirin to prevent clot formation, especially to prevent the formation of clots that block blood supply in the brain. Shock is something that results from the collapse of all the blood vessels. All the blood vessels just lose their tension and essentially the fluids kind of leak out of them. And that's obviously is a medical emergency. A very common condition related to the cardiovascular system is anemia. Sometimes the anemia, which means that there are not enough cells to provide enough oxygen, okay? Sometimes that's because the cells themselves are not available, the bones are not making enough cells. Sometimes it's because the cells are not properly formed, and sometimes it's because a person is not receiving enough of the minerals so that they can build good red blood cells, and the red blood cells are the ones that carry the oxygen. So the kind of medications that we see given for the cardiovascular system, the most familiar ones would probably be the ones for blood pressure. And blood pressure can be treated in a number of ways. One way is to take the blood vessels and dilate them. Dilating means making it bigger, okay? If you think of your heart as a pump, okay, and it's pumping into pipes, the larger the diameter of the pipe, the less hard it is for the heart to pump. So we use these vasodilators to relax the arteries and to allow the heart to get the blood out into the body. And there are some examples here of prazosin and nitroglycerin. We use drugs to treat the cholesterol level in the blood. We want to keep down the cholesterol and the triglycerides so that we don't develop plaques inside the blood vessels. We also use the stimulants, as I mentioned, digoxin. We use drugs to calm those renegade spots in the heart muscle that want to take over the rhythm. So we use things like atenolol or quinidine. And a lot of these drugs interact with each other, so keep that in mind. And besides just the low-dose aspirin, a lot of our patients or residents are taking warfarin, which has a higher risk for bleeding. And we also treat people to try to prevent anemia. Now, not all anemias in elderly people are treatable, but when we do treat them with iron, which is ferrous sulfate, and we treat them with vitamin B12 and folic acid. So you can see how important it is to keep in mind, that all of your body systems have to function together, and that any time that you really stress one body system, it's going to affect how the person feels and how they're able to function. The respiratory system. The respiratory system includes everything from your nasal cavities and sinuses down through your pharynx to your larynx, that's where you talk from, into your trachea, which is your windpipe, and the branches off of your windpipe are called your bronchi, and then just your lungs in general. So it's a pretty big system too. its main purpose is to exchange gases. Our cells use oxygen as fuel, and they create carbon dioxide as a waste product. And the exchange of those gases goes on deep down in the tiniest little parts of our lungs. As we age, a lot of the problems with our lungs are actually kind of related to our muscular system because we're less able to draw in deep breaths. And that's partly because the muscle that's called the diaphragm that lies right below the lungs is not as strong. So we can't draw in these nice deep breaths as easily. So what you get is a lot more shallow breathing, okay? And in order to provide enough oxygen, people tend to have to breathe a little more often. So you have this shallow breathing, it's more rapid. You have less gases exchanged in each breath. And one of the kind of interesting things is that people's voices changed, and I'm sure that you've met people or seen people on TV who have these very characteristic voice changes that are related to aging. That's because of the muscles in the larynx. Those muscles become weaker or they actually get stiff. And people also have a tendency to get kind of a chronic tickle in their throats as they age. One thing that you can do to help somebody who has a very faint voice because of these changes of aging is to suggest that before they speak, that they take the deepest breath that's comfortable for them and then speak, because the sounds are made as the air goes out past the larynx. Some of the common disorders that we see in elderly people include pneumonia, and we vaccinate for that. And you need to keep up with what the recommendations are for vaccination. It used to be just once in a lifetime, but I think they're reconsidering that. Also, people get bronchitis. They get chronic bronchitis, which means that it goes on, as opposed to acute bronchitis, which is a one-time sudden event. The bronchitis and emphysema together, we call those COPD, or chronic obstructive pulmonary disease. And as I mentioned earlier, that's the fourth leading cause of death in elderly people. Because the exchange of gases is so much more difficult, in people with emphysema, they spend a lot of their body energy just breathing. And so you'll tend to see them develop sort of a barrel chest. A lot of these people will be very slim, even if they eat a lot, because they have to eat a lot to produce the energy they need to breathe. So they'll be real slim and have this kind of barrel chest. Cancers of all kinds are more frequent in older people than in younger people. And that's regardless of which body system we're talking about. The pulmonary embolism, which is listed here in number 4, is an example of a clot that would be in the lung. So we talked about that under the cardiovascular system. One thing I want to bring to your attention is that we're finding more and more older people who have active tuberculosis. Other things are basically just inflammations of the nose and sinuses, and those things are very much related to humidity. So when you have heat on in the facility or when you have air conditioning, that tends to remove a lot of the humidity from the air, and that can cause a lot more infections in older people. Some of the medications that we use for diseases that are very prevalent in older people include antitussives. Those are things for cough. And one of those is codeine. Codeine is no more effective and has a lot more side effects than something like dextromethorphan. Dextromethorphan, I love saying that word, is the DM in things like Robitussin DM, okay? And it just suppresses cough. Expectorants are things when you have, you use an antitussive when you have a dry cough. If you have a cough that's productive, if the individual is coughing something up, you may want to keep that cough loose, and so the material can be coughed out effectively. You use an expectorant for that. The most effective expectorant is water. That would be 8 glasses of water a day. That's a lot of water. If you're having a hard time convincing the individual, and I have a hard time convincing myself sometimes to drink that much water, then you can use something like guaifenesin. And that is the plain ingredient in, say, Robitussin or Guaitus. We also use decongestants. Those constrict or tighten up the blood vessels. We use those normally in, say, nasal sprays. And the reason that we would use a topical instead of an oral decongestant would be that we want to just treat the part of the system that needs to be treated. When you take a medication orally, it treats all the cells in your body. It treats your fingers as well as your nose. So anytime a specific area can be treated, then we try to do that. We use antihistamines, those black body chemicals that cause allergic reaction. We use bronchodilators. Those are things like theophylline, which every time you hear it, you should be aware of the fact that it interacts with just all sorts of other drugs. We also use some of those puffers, the inhalers like albuterol, which open up the trachea and the bronchi. There are anti-tuberculosis drugs. Those interact with a lot of other drugs. And also the rifampin, which is listed here, I believe is the one that turns your urine orange. It's important to know when drugs do things like this because it can be really frightening. I mean, suddenly you see orange urine. No. Antibiotics in general are used for respiratory conditions. We use things like cefaclor, we use amoxicillin. Now, new antibiotics are coming out on the market all the time. It's important to remember that new and more expensive is not necessarily better. And sometimes that the condition is not something that is treatable with an antibiotic. It may be a viral condition. If it's a virus, we do not have antivirals that will handle things like a virus infection causing cold-like symptoms in the upper respiratory system. The nervous system. The nervous system includes the brain, the spinal cord, and the peripheral nerves, or just the nerves out here, out in the world. The sensory system includes your eyes, your ears, your sense of smell and taste, and also your sense of feel. Another sense that we have is our ability to sense where we are in space. For example, if I hold up my left foot, I know that where it is. That's another sense. And another sense is our sense of equilibrium, and that's a sense that is affected in a lot of older people, and that's related to an inner ear issue, which we'll talk about when we run into the condition called Meniere's disease. The function of the nervous system is it's pretty much the master of the system. It tells all the other body systems what to do. It controls and coordinates all of these functions. And like I said, it also lets us know what's going on in our environment. What happens to the nervous system as we age is something that we need to be very careful about when we talk about it, because some of the things that we see are not normal changes with aging. And this may be information that's been covered in other units or that you are already aware of, but I really want to make this point strongly, is that when people age normally, they don't lose their ability to solve problems. They don't normally become confused. That's not a change of normal aging. Really, one of the changes with normal aging is a slower response. And that may not be due so much to slower processing. It may be due to the fact that, think of how much more information you're going to have when you're 80. How many things an 80-year-old person has experienced and how many experiences they have to sift through to make connections with what's going on right now. So that's not necessarily a disadvantage, but the slower response time is something that is part of the normal aging. The other thing is that because of changes in the other body systems like the cardiovascular system, there is less blood going to the brain a lot of times. So a person just may not feel as alert. People react to stimuli, their reflexes are slower. One of the changes that we see that really bothers a lot of our residents is a change in their sleep patterns. As people age, they experience a lot more nighttime awakenings. They have less of the deep sleep that they associate with good quality sleep. And it may take them a longer time to go to sleep. And this can be due to a number of factors, or a number of things can make it worse, but it is part of the normal process of aging. We don't sleep as adults like we slept when we were infants. And as older adults, we can't expect necessarily to sleep like we did when we were younger adults. But people do need to get enough rest to keep them from feeling fatigued all the time. When the sensory system ages, now this is a really important part of aging for you to be aware of, because a lot of challenging behaviors are related to sensory changes. The messages, sensory messages, don't necessarily get in to the person as well as they did when the person was younger. And that's related to some of the common disorders that we see in people. For example, with the eyes, because of changes in the muscles in the eyes have a harder time adapting to a change in light. So going from a lighted room to a darkened room, a person would be more likely to fall if they were older because their eye doesn't adjust as quickly. Also, people, they hit about 40 or 45 years of age and they need reading glasses. And that's because also of those muscles in the eye that don't accommodate to the print as easily. They don't focus the light as well on the back of the eye. And the other thing that happens is as people develop cataracts, they tend to complain more about glare. So the lighting in your facility needs to be created with that glare issue in mind. Glare can make it very difficult to read. It can make it difficult to tell whether a person is looking at a bowl of mashed potatoes or whether they're looking at a bowl of cauliflower, for example. Ears have a tendency to hear the higher frequencies less well. The senses of taste and smell are somewhat diminished, but not, it's quite variable depending on the individual. Another sensory problem that occurs is the sort of dullness of the sense of touch. And I've had people come into the pharmacy, I do spend a day a week in the pharmacy now, come in and complain about the tiny tablets because they have a tendency to drop those. And unfortunately, some of those tablets are tablets of, say, controlled substances, and if you weren't aware of the fact that they do have more trouble, you might think they were abusing the drug. So that's one of the things that we keep track of, is we try to give them tablets that are manageable and that don't make them feel disabled. Some of the common disorders we've started mentioning already include the cataracts, and that's really, it's just a clouding of the lens itself. And it causes some blurring, and it causes some hazing, and it causes a lot of the things that you look at to have a sort of a yellowish cast to them. Macular degeneration is another important condition, and it occurs especially in people who have diabetes or who have had diabetes for a prolonged period of time. That particular condition, the blood vessels that supply the eye, if this is the eye and the eye is looking at you, the blood vessels that supply the eye are on the back side, and sometimes those blood vessels become injured or damaged, and they can't supply the eye with with the nutrients it needs, with the gases, and remove the waste products as well. Glaucoma is another common condition. That's an increase in pressure within the eye. And if, for example, one of your residents experienced a sudden onset of severe eye pain, that would be a medical emergency, simply because it could indicate glaucoma. And glaucoma is one of the most, it may be the most frequent cause of blindness. Some of the nervous system changes that occur include Parkinson's, which is a motion disorder. It's related to the degeneration of part of one particular part of the brain. And it is manifested first by a resting tremor and by a slow shuffling gait. It's a very unpleasant condition. It's a progressive condition and normally occurs in people, say, over 50. Other things that you see, cerebrovascular accidents, that's in your list. A CVA is a stroke. Some of the medications we give to residents, infrequently we give Ritalin, which we would give only in cases of very resistant depression. But we do use antidepressants, and the examples we gave here, we gave amitriptyline because it has sort of the shotgun approach. It changes a lot of different chemicals in the brain. And the other example is Paxil, which is very specific. It's very selective for changing only one particular chemical in the brain. So, you know, you can go the whole gamut from changing lots of things to just changing the one. Personally, I prefer the most selective product that's possible because it would have the fewest side effects. We use analgesics. Under D, E, and F in your workbook, these drugs are classified as psychotropic drugs, okay? They're psychotropic because they have the ability to affect behavior. We give anticonvulsants for those seizures, particularly the seizures that result, say, from stroke. And we treat Parkinson's. Now, the treatment of Parkinson's is a dilemma. It puts the patient between a rock and a hard spot. The Parkinson's by itself is very disabling, and the medications we use to treat it can cause side effects like hallucinations, bad dreams, psychosis. So, you know, the management of those particular medications, you really need to be monitoring people with Parkinson's very carefully for behavioral changes. Let's move on to the next system, the gastrointestinal system. The gastrointestinal system includes everything from the mouth, the esophagus, which connects the mouth to the stomach, the small and large intestines, the anus, the gallbladder, and the pancreas. So and the liver. So it includes an awful lot of what's in the middle of you. The function of the gastrointestinal system is to supply the rest of your body with nutrients and fluids, and also to remove waste from the body. It also reclaims a lot of the fluid that's inside of your intestines. And when you have stool excreted, really the bulk of that is not just waste food, but it's actually bacteria that were helpful in breaking down the food so that it could be absorbed. As the intestinal system ages, one of the most interesting and difficult things to treat is the decrease in saliva. Other conditions, the inability to gag, the gag response is depressed, and generally things just move more slowly through the intestinal tract. Now, part of that is related to diet, part of it is related to inactivity, and part of it is just a natural function of aging. But the more active the individual can be, generally the better off their intestinal tract will function. People tend to get more gas and bloating. They get more reflux from the stomach because the little valve, that's not really a valve, but it functions as a valve, between the stomach and the esophagus that's weaker. They're more constipated because of the slow motion of the materials in the intestinal tract. And generally, food is harder to digest because the stomach is not quite as acidic as it was at a younger age. So some of the common disorders you could predict. People have gum and tooth problems, and that is in part related to nutrition and in part related to the saliva problem. They have the hiatal hernia, which is that hernia right there at that junction between the stomach and the esophagus. They may have stomach ulcers, and a stomach ulcer in an older person is a very serious issue because of the slower healing in older people. The onset of gallbladder disease usually is highest in the age 50 to 60 group and increases after that, I believe. So you can get obstruction of the bile ducts, which is a very painful condition, or you can just have a less efficient gallbladder. The gallbladder deals with fats in the diet, and that's its important function in the intestinal system. People can get ulcerative colitis or enteritis. That means that either their colon or their intestines are inflamed or infected, and we give a special kind of antibiotic for that. A lot of older people experience what's called irritable bowel syndrome, which just means that their guts bother them. You know, when they eat, they get a lot of gas, it may be painful, or they have certain foods that they try to avoid because it bothers them. At the end of the gastrointestinal tract, you see a lot of older people with hemorrhoids, and we want to try to prevent those. They're very painful and can cause a lot of problems, and one of the most helpful things we can do is keep people hydrated. Plenty of fluids and fiber in the diet, and hopefully that'll keep the hemorrhoids from being a big problem. You're probably familiar with most of the medications that are listed in your workbook. Antacids for neutralizing stomach acid. Some of the non-prescription products like Pepcid, that also neutralizes stomach acid. The digestants, that's for people who have problems with their pancreas. So they don't secrete enough of the enzymes that break food down. So this is a replacement for that. The anti-flatulence, that's a very polite way of saying they work on gas. And the only approved product at this point is simethicone. Simethicone just takes big gas bubbles and breaks them up into smaller gas bubbles. And so it makes them less painful. Antiemetics and emetics, that's pretty straightforward. This Emitrol I've included here in the workbook because that's a non-prescription product. But if an individual is having vomiting, you need to contact a physician, okay? This is not just something that you would treat on your own, even though the product is available without a prescription. Anticholinergics slow the muscles in the intestinal tract. And some people who have irritable bowel syndrome receive these anticholinergics. But we need to remember that those cause dry mouth, blurred vision. They can cause retention of the urine. They can cause confusion. So sometimes the trade-off is not good there. The cathartics you're familiar with, a lot of older people are dependent on the use of cathartic laxatives. And stool softeners, I'm partial to those because they don't seem to interact with any other drugs, and all they do is pull water into the stool to soften it up and make it easier to pass through the body. I've included the sulfasalazine here. That's a kind of antibiotic and anti-inflammatory that's used for conditions like diverticulitis, which is an infectious condition in the bowel. Let's go on to the urinary system. The urinary system includes the kidneys, the bladder, the ureters that connect the bladder to the kidneys, and the urethra that removes the urine from the body. The function of the urinary system is to remove water-soluble wastes from the body, and it's also to help maintain the fluid and salt balance inside the body. The urinary system is one of the ones that is most affected by aging. Your kidney capacity decreases about 1% per year after age, say, 30. So by the time an individual gets to age 80, they have maybe only 30% of the kidney function that they had when they were a young adult. Generally speaking, that's perfectly adequate for their normal function. It's just when something unusual happens, when they develop an illness, or when we give them medications that require kidney excretion, that we see that they have less of a reserve so that they can end up having kidney problems. Now, as the urinary system ages, part of the problem is the heart. Again, the heart pumps less blood to the kidneys, so the kidneys are working at a lower capacity. They aren't filtering as much blood. They are not quite as good at maintaining that balance that we try to maintain in the body between the salts and the fluids and the cells. As you age, your bladder is not as elastic, and so it can't hold as much urine, and so a lot of times you'll see that individuals have a problem with overflow incontinence. Simply, the urine just comes out because the bladder can't expand anymore. The size of these organs actually decreases as people age. Now, some of the common conditions that we see in the urinary system in elderly people are obstructions. Obstructions are our main problem, and one of the main sources of obstruction in men is an enlarged prostate gland. That can either keep people from being able to urinate, or it can cause them to be incontinent. Other problems we see with the urinary tract are infections. Infections can be manifested by, say, confusion, or by fever, or by discomfort. We have a list here of other common problems: kidney failure, incontinence, an electrolyte imbalance, or urinary retention. And the medications we use, often we use antibiotics. We use diuretics. Generally, the diuretics are used for blood pressure, but they can also be used to help the body maintain its balance of fluid and salts. We use antispasmodics, especially when people have incontinence. And urinary analgesics when people have pain with urination. And then the antiseptics we use often just to prevent infections. So let's move on to the endocrine system. The endocrine system includes all of the glands that produce hormones in the body. That's everything from the pituitary, which sits in the middle of the brain, to the thyroid, the parathyroids, the adrenal glands, the pancreas. See, that gets to be in two systems, and the ovaries and testes. Hormones basically regulate the rate at which activities occur in the body. Okay, they regulate speed. They regulate what kind of activities occur. And as we age, what we find is that those glands work less and less well. And for example, a lot of older people experience hypothyroidism, which is the thyroid gland is not putting out enough hormone, and so they need a replacement hormone to be given every day. Some people develop diabetes. There are two main kinds of diabetes. One develops more often in younger people, but older people can develop diabetes where their cells are resistant to absorbing sugar, and that's because their pancreas is not producing insulin properly, or their cells just don't recognize the insulin that's being produced. Other things we do see Cushing types syndromes. That's under D. under Cushing's disease. It's not that that's such a high prevalence in older people, but we do see it develop as a result of long-term therapy for lung disease and for arthritis. The medications that we give for these kind of disorders, it depends on what kind of hormone we are replacing. For example, we can give estrogens. It's possible to give Proscar, which is for it's for enlarged prostate. We can replace insulin, or we can make the cells more susceptible to insulin, make them more sensitive to the insulin and let them use the insulin better. That's with the oral medications. Corticosteroids are used for hormone replacement. They're used to treat allergic reactions and inflammation, and you often see them used in cancer chemotherapy. Let's go on to the reproductive system now. The reproductive system in men includes the testicles, penis, and prostate. In women, it includes the ovaries, the fallopian tubes, the uterus, and the vagina. The function of the reproductive system is basically to reproduce our species. Some of the common disorders we see in men, we've talked about the prostate problem. We mentioned before that cancers of any kind of system are higher in older people. Women often experience vaginal infections, and we'll talk about the treatment of that. And in some older women, we see a prolapse of the uterus. That means that the uterus just sort of slides down into the vagina, and that's a difficult condition which is generally not treated surgically in older women. Some of the medications that we use in older people, we talked about the Proscar for men, for their prostates. And for women especially, when they have vaginal infections, we're using antibacterials, and we're also using antifungal products. And we also use the hormone replacement, not just the estrogens, but if a woman still has a uterus, we also use the progestins to kind of balance out those effects. And then you do also see a fair number of individuals who are receiving some kind of cancer chemotherapy for cancers of the sexual organs. So let's wrap this up by talking about what happens to drugs when they enter an older person's body. It's important that you understand that there are changes that occur in the absorption, the distribution, the metabolism, and the excretion of drugs. Let's wrap up aging and the body systems by taking the post test. Well, this concludes aging and the body systems. Thank you for joining me, and I hope I'll see you again next time.